Hello, everyone, and welcome to another episode of the Love Fruit podcast. And today we're speaking to our special guest, Dr. Tumi Johnson. And Tumi, what I want to first ask you about is your own background. Of course, you're a medical doctor, and I'd like to find out how you got into that. Also, though, you do look at the other side, the nutrition side, the lifestyle side, in terms of um, helping people deal with disease. And
Mhm.
but yeah, I mean, what's your background and how were you brought up? What was your diet like then? How did it
Mhm.
all change? And we'll also go into your training as well after that.
Okay, sure. So I spent the first around 12 years of my life in Nigeria in West Africa. And then my family and I moved to Nashville, Tennessee in the United States. And when we were living in Nigeria, we had what's called their farm, basically a big garden where we grew things like corn and beans and greens and tomatoes. We had fruit trees, grapefruit trees,
Mhm.
and mango trees. So my point is, I had a pretty healthy diet, whole plant foods. We also did eat some animal products. We had chickens and eggs, and I would eat goat meat also. But it wasn't until I think I was around 12 or a little bit less than that before we moved to the States. When we were in Nigeria, I was then at that age invited to start helping around the house with cooking. And that was the first time I remember seeing a chicken being slaughtered for our food. And that was the beginning of the end, I like to say. That was when my mind uh, just couldn't wrap around it, because I remember the chicken crying for its life.
Yeah,
And so then we moved to the States, and pretty soon afterwards, I read a book called Diet for a Small Planet. I think it's by LePay, and soon after that I stopped eating animals. I did continue to eat dairy and fish because I didn't make the connection at that
hmm,
point, the humane connection, for several years, but that's when I stopped eating animals. So I was eating a pretty healthy, a whole foods diet in Nigeria. When we moved to the States, I started eating more processed food because that's what was
sure.
around. That's what my friends were doing. And as a tween girl, that's what I wanted to do. I wanted to fit in. So I think
Sure.
I started eating processed food because that was really more and more widely available to me. And then after a while, the addiction took over, because I think these
Mhm.
foods are definitely addictive. And so they became more and more part of my diet.
Sure. And so you obviously were making changes. You'd already made some changes, but what kind of well, firstly, let's go before we go into the diet and everything. What made you go down the path of medicine and
Mm.
the training to obviously all the training that goes into becoming a doctor?
Yeah. So when I was a little girl, I write about this in my book. I have a book called Delicious Healing that talks about my struggles, overcoming my health struggles and my path of that, and what I now teach and share with my clients and patients. And I talk about the fact that I was a pretty sick child, and I had really bad asthma,
Hmm.
eczema, which I struggled with. So I knew hospitals very well. My father was also a doctor. He was in academic medicine. So he did a lot of teaching, but he was a physician. He's retired now. That's why I'm using the past tense. So I knew very much about the medical world, but I also
Hmm.
loved nature. I was always outside on my bicycle and my skateboard. I was always in trees. So I loved the plant world. And actually my focus in university was dance and also environmental biology. So for me, there was a big connection of us as human beings, as animals, and part of the natural world. And because I'd been a sick child and I'd seen that world, a big part of me wanted to help others as I was getting healthy myself. So, and the world was familiar to me through my father, but I also knew I wanted to do medicine a different way. My mother bought me a textbook called Alternative Medicine when I was about 14, because I always loved things like herbs and also nutrition when I was younger. So I went down that path because of that, for those many reasons.
Yeah, yeah. And were you taught much about nutrition in medical school and medical training?
Great question. And the short answer is no. And I went to one of the top medical schools in the country. Fantastic education, very little on nutrition. And it wasn't until I did work as a field doctor with Doctors Without Borders in West Africa that I really experienced the link between nutrition and health, because I was working with malnourished children for
Mm.
who are dying due to their malnutrition of other diseases. So I saw that when we got out of the body's way and gave them the food, true food they needed, the body took care of so many things. And that's when my eyes were really open to the power of nutrition. And so I came back from that experience in the field to my life and took a look at my diet. And I thought, okay, I have some things to do with my own diet to change. So that's how and that was probably my late 20s. It's been now 9 years ago. That's what then, 10 years, I think now, opened up the door for me to start moving towards a completely plant foods diet. And now, I mean, a living foods diet for me.
Yeah, so um, obviously you were starting to make those connections, and with your childhood, you'd experienced a kind of a whole foods diet and the difference with the processed diet moving to America.
Mm-hmm.
Um, but what were the things? I'm guessing something personal happened to you to make you start to explore raw foods, living foods,
Mm,
and that kind of, a diet that's probably more extreme to a lot of people, um,
yeah.
especially people in the medical community, maybe not very supportive of that kind of idea.
Yeah, that's a great question. I think, I struggled with severe depression and a disordered eating behavior that really flourished after my parents broke up. The marriage ended, and I think emotionally it really hit home hard for me. And I started using food as a coping mechanism, a very poor one, and specifically processed food. And so my disordered eating behavior just got worse and worse, and it really probably peaked in terms of how bad it was in university and college. And but to the outside world, I looked fine. I was a dancer. I was, going to medical school, and then I was in medical school, still struggling with this issue, getting more and more depressed. And I talk about this in the book, but I will share that, after getting therapy, after exploring the emotional aspects of what was going on, which I think is so key, and frankly has been very key in also helping me stay on a living foods path consistently. I don't think we talk enough about emotions and releasing and honoring our emotions. So I did that work, and that was amazing. And it helped with so much of it. But as when I went to Africa, when I went back to Africa and I did this work as a physician, seeing people heal, and especially the most vulnerable of us, little children,
Hmm.
to see them heal so well, coming from being emaciated, or having kwashiorkor, which is another type of malnutrition, to having these plump cheeks, and it was like being on the edge of death to thriving, all from supporting their nutritional
Yeah.
status. um, that really caused me to say, okay, I need to spend more time looking at nutrition. So I came back and started doing some self-study. And then I did some study through the Institute of Integrative Nutrition, through IIN. And then I did more study through the American Board of Integrative Holistic Medicine, learning more about nutrition. And it was this kind of, Ronnie, it was kind of like I don't want what to say, kind of a rabbit hole. Is the more I read, the more I wanted to read. And I remember thinking, how was I not taught this? Did this, how was this not a huge part of my curriculum in university and medical school? Why is this the first time?
Yeah.
And so I started implementing in my own life. So very, very quickly, it was clear to me based on the medical literature that a plant foods diet, specifically a whole plant foods diet, could be and had been responsible for reversal of things like heart disease, diabetes, obesity, fatty liver disease, the list, cancer. great studies showing this. And so I started going to these medical conferences and meeting people, these researchers like Dr. Ornish and Dr. Esselstyn, and it was mind blowing. And I could not do anything but change my diet first. And then when I saw the
Yeah.
huge changes, I then had to start talking to my patients. There was no way I could keep quiet about it. The Living Foods diet, I'll just say quickly, is I love reading. I've always been a big reader. The books took me to Living Foods, you know, or maybe just fate did. I don't know. But I started reading Arnold Ehret, and I started reading newer things by Gabriel Cousins. And then I don't know how I heard about this thing called the Woodstock Food Festival. And in 2011, that was the first one. I went there. I read Doug Graham's book in one night, like in 3 hours. And it was clear to me from the literature I'd been reading before, some of what he wrote, and then more importantly, my experience and what I was feeling, that this is what I wanted to do. This is the change I needed to make. And I've not looked back since.
Incredible, incredible. So you went to the first Woodstock Fruit Festival?
I did.
Oh, wow. That's amazing. So that's when you kind of went towards the fruit, more of the fruit-based kind of thing?
Exactly.
And so you read kind of Arnold Ehret and stuff. It's interesting, the word living foods. Were you interested in the sprouting type of thing and green juicing and trying that out as well?
I did. And you know, I know there are all these different modalities or maybe schools of thought. And I think what I always say also to patients and clients now is, do what really resonates the most with you. And that might change in your journey. And I'll share with you that, you know, I don't consider myself 80-10-10. For one reason, I eat a higher percentage of fats, slightly higher than probably what's recommended for 80-10-10. First of all, as a woman, and now as a breastfeeding mama, that has worked better for me. But I also have incorporated sprouts and things like seaweed with really good results. It just feels better for me than maybe just, and also spices. I'm an African girl. I need like my hot peppers. And so, you know, I think maybe I lean towards that, but I also have worked with cancer patients, and I've worked with people who are healing from severe autoimmune disease. And for them, it's a different protocol, a different diet that I usually recommend. So I think you have to be kind of true to where you are and who you are. And so for me, it's kind of, I don't know if I could ascribe myself to one school, but I do incorporate sprouts. And I do incorporate lots of greens, seaweed, like I mentioned, but my diet is definitely fruit-based.
Oh, wow. And do you stick to mostly raw as well, or completely raw, or what kind of balance do you stick to?
Yeah, great question. You know, I think for me, and this is also, I think, an individual thing, I feel my freest not eating cooked meals. So I would say I'm more than 99% raw. I don't like to say 100% or fully
Sure.
raw or any of those things, because, you know, if there's some cooked peanuts on my papaya salad, you're in Thailand, so I'll say that I'm not going to,
Right,
it's not,
yeah.
it doesn't cause me to freak out. If I have toasted nori sheets as opposed to raw nori sheets, you know,
Sure.
cashews are considered heat treated, but I'm more than 99% raw, and I feel my least restricted and my most free because of that. For those people who feel really restricted and they also feel good on cooked food like potatoes, my husband, for example, loves quinoa, cooked quinoa, or sweet potatoes. That works great for him. For me, I just want the fruit and the greens, the raw
Right,
greens.
right. Um, so kind of from the Woodstock Festival, I mean, how was your transition to the way you eat now? Did you find it an easy transition? Did you go back and forth a lot? Did it take a lot of time for you?
I love that question. The answer is, it took me, I end up creating a webinar called, like, I think it's like the 5 tips of success in a raw vegan diet, because my journey was tough. And the reason is, I think, because I went from eating dairy and fish, went to the Woodstock Food Festival, and came back raw vegan. Fruit-based raw vegan. There was no, you know, it was like done. And that lasted for about 3 days. And I remember I was in a relationship at the time with a person who was a meat eater. and the relationship was not doing well, and emotionally I was not feeling really good. I remember I came back and he said, your eyes are so bright, they're too bright, they're so clear. And 3 days later I was back to eating. Now I didn't go back to animal products, but I started eating white rice and stuff that I knew that would numb me out, because it was
Sure.
hard to look at the truth of my relationship. And so I think I bring that up because I think there can be this like honeymoon experience in festivals, but I
Mm,
think you then have to go back to real life and be really honest with yourself. And so I did go back and forth, and it went on for about a year and a half. And I would go back to cook food and I would feel terrible, not emotionally or not guilty, but physically sick.
mm,
And then after a while I said, I just don't want to feel that anymore. And
yeah,
I had to also change my languaging. This is huge. I talked about this with patients and clients. It was no longer, I can't eat rice or potatoes or something even like bread. It's I choose not to. You know,
sure.
the treat for me is that delicious salad. The treat for me is my raw pizza when I choose to make that. I think there's
Mm,
so much conditioning about what a treat is or a cheat day. And so really kind of healing myself from those sabotaging, I think, mind chatter or self chatter was really helpful for me. So it's a long answer to say yes. I went back and forth for a while, but I kept tweaking. And what I say to people is, this is something we learned in my medical residency, is there's no such thing as failure. There's relapse, and with relapse, it's not failure, but success if you can think of it as an opportunity to hone your strategy. So each time I, quote unquote, fell off, I would just hone my strategy, and it kept getting better and better and better, to the point that now it just feels easeful. You know, it's not.
yeah, that's really great to me because like a lot of people, they fall off and they're like, I can't do this. That's me
Yeah,
finished.
yeah.
But what you're sharing here is
Hey,
you
baby
fell off
boy.
multiple times from your path.
Yes, absolutely.
You
Oh, hello,
you
baby. Hey,
you
baby.
saw it as something different.
Yes.
You saw it
Say
as
hi.
basically a part of your process, I guess, or is that how you looked at it? Or
Absolutely. I think the idea, you know, somebody who I really was inspired by was a woman called Annette Larkins, and she's been
mm,
a raw foodist for, I think, 40 plus years now. And in her first book called Journey to Health, she talks about how she went raw and she didn't look back, but she couldn't stop eating cottage cheese for years.
right,
And she
right.
and at some point she just said, okay, I'm just going to eat the cottage cheese. And then one moment she finally was eating it, and then she was like, I'm done with this. And I think if you can take away the shame or the self-judgment and just get very, I talk about a lot also mindfulness with meals, whatever you choose to eat, just be present with it.
Mm,
And I think when we do that, we can really tap into our body and our body's wisdom. But I think letting go of the judgment and the rules. That's why I'm never going to call
sure,
myself 100% raw, because I just
sure.
don't want that label on myself. Even though I am eating, you know, more than
Yeah,
99% raw.
yeah.
So I think that really helps me. Like you said, just honoring the process and trusting that my vision, I would get
Mm.
to my vision at the right time if I just stayed mindful and present. And that's what's happened. Hey, baby. Ronnie,
So
I'm gonna give Sky to Jade. Can you give me one
no
moment?
problem. Yeah,
Thank you.
yeah. So and what kind of tips would you have from your experience for people who are beginning on this path,
Mm,
who maybe aren't really sure what they're doing or struggling with it? What what would be your kind of basic guidance,
yeah,
advice, tips?
that's great. I'm gonna pull the one is coming from me. Two are coming from me from the webinar that I did on success tips. Immediately, it just comes to me, and it's definitely been my experience and continues to be my experience. First one is know your why. Know your reason for doing this in the first place. Your own reason, not anybody else's in the movement's reason. Your own reason for doing that. I think that having your powerful reasoning will help you navigate. The second thing I would say, and this might seem kind of out there, but I think is so key, and it's one of the reasons I see people fall off, is really honoring your emotions and releasing difficult emotions. So getting comfortable with your shadow self and shadow emotions. And I think it's really key because it's been my experience that this lifestyle, a living foods diet, really uncovers, it kind of creates this situation in which it removes stuff out of the way so you can see more, see
Wow.
yourself more, see the world more. And a lot of us don't want to see. We really
Right.
don't. And subconsciously or consciously, we use different tools to blur our vision so we can get through life. And so unless you have a system, unless you have a system of managing that without using coping mechanisms like processed food or alcohol or insert whatever you want here, people will keep on falling off. A lot of people will keep on falling off. And so I think those are two things that I would say. And then there's the practical things of eating enough fruit. There's a practical thing of finding a few foods that you really, really love and
Yeah.
making sure you have that. Because I think it can't be also just willpower. For me, that's
Mm.
why I called my book Delicious Healing, is I think this diet has to feel like, for me, I feel like I treat myself every single day. Like it's
Yeah.
just, so I think, that has to be part of it. Figure out how to make it really delicious for you. And also eschewing or releasing this idea of perfection. Let that go.
That I love the title of your book, Delicious Healing, and
Thank you.
I'm ashamed to say I've not come across it. I've not actually read it, but I would love to get a copy, so I'll go and have a look at that.
I'll be
Um,
happy to send you a link. Yeah.
yeah, fantastic. Uh, Great. Now you've went forward, and obviously you've had a child. And
Yes.
was that? Well, obviously I can see the age of your baby. I'm guessing that was on a raw vegan diet, the whole process. And what's your thoughts
Yes.
on that? On raw vegan diet for pregnancy and for the woman, for the child, and all that information.
Thank you for asking that. So before I got pregnant, I already felt like this was the diet. This diet was so amazing for me. So I'll just be very quick about it. Like depression gone, eczema gone, lifelong asthma gone. Achieved and sustained my ideal weight for 8 years now, no problem. I'm a dancer. I'm a
Mhm.
professional dancer. My performance improved so much. My stamina and flexibility. So on so many levels, the diet was healing for me. And then enter this. So I'll share with you, I'm now 42 years old. So I had a healer told me, oh, you're an amazing healer, but in this lifetime, given your age and given some other things, you probably will not be able to have a child. I wasn't looking to have a child at the time. When I did want to have a child, I conceived with my sweet husband our baby within a month of trying to be pregnant easily. And I know for a fact that a huge part of that was the way I eat, was my diet. The pregnancy was easeful. I had no issues. I had no with like morning sickness, none of that. So no morning nausea. I didn't have anything like swelling in my ankles, which women complain of, back pain. I didn't have the usual quote unquote complaints of pregnancy, none of that. It was
Right.
so easy. We were traveling throughout most of it, and that was easy for me to do. And then we had a natural home birth, just me and my husband. It was the two of us. It was a free birth, unassisted birthing experience, and all powered through a living foods plant diet. And our baby came out completely healthy. He is thriving, and he's exclusively fed on breast milk, but I'm exclusively fed on living plant foods. So I feel like he's being
Oh, well.
exclusively, being fed on that. He's amazing. So
Yeah.
I say all that not as a pat on my back, but as really to share that with other women who might be interested in this, because it's not a lot of literature out there. There is a book called, I believe it's Creating Healthy Children by Karen Ronzi, which I
Yeah.
read throughout my pregnancy. And I think it's a fantastic resource for women who might be interested in this lifestyle and going to be pregnant or wanting to raise their children. I'm not sure how to do that. I think she's got some great stuff in that book.
That's really interesting and great to hear. Um, I'd like to ask a little bit about breastfeeding because I've noticed that for a lot of women, especially in the standard diet, breastfeeding can be quite an issue in terms of being able to produce enough milk. And
Yeah.
what I see is that a lot of women they assume that what they should do is if they want to produce more milk, they need to drink more milk, and they start having milk, yogurt, cheese, things like that, because they assume that that is what will increase the flow of their breast milk for their child. Um, I mean, what's your thoughts on that? And do you have any issues with breastfeeding on living foods?
So I'll answer that question first. I had no problems. My breast milk flowed, and I will also say that I'm pretty slender, and so a lot of people thought, oh, how are you going to produce enough milk when you're so slender? My
Yeah.
breast milk has been more than enough for my baby. And in fact, if we're living somewhere where I would donate the excess to women who are around. That's how much milk I have.
Wow.
And I know, again, a lot of that has to do with my diet because this diet is so hydrating and it's also
Mhm.
anti-inflammatory, right? So all the structured living water and the fruits I eat, I have a YouTube channel and I'm actually about to, I think it's tomorrow, the next day, there will be a what I eat in a day as a raw vegan breastfeeding mama. And people are going to be like, what, I don't understand, but it's what I eat right now. It's winter citrus. I had today about 20 oranges and some kiwi for breakfast. And that's so full of water that's hydrating me and then that's hydrating my child and producing that breast milk. When people think that you need to have cow's milk or animal milk that's not from us to produce milk, it's actually almost the opposite because a lot of these foods, the animal products, are pro-inflammatory. And when
Right.
you have pro-inflammation, you create mucus. And to get that out of your system, your body needs water. So mucus is not just inflammatory cells, it's also water. So your body will actually leach water because it needs to then deal with the
Mhm.
inflammation to get it out of the system, or to flush your kidneys, it needs water. So all your organs that are helpful for elimination, your lungs, your skin, your kidneys, your liver, need hydration to manage inflammation. And so it's actually the opposite. What you do is you're stealing water from yourself when you're eating foods that are pro-inflammatory, whether it be cow's milk or goat's milk or cheese for sure, not to mention the dehydration of lots of cooked foods. If you're eating a living foods diet, a living foods plants diet, you have the opposite issue. It's so much hydration. I don't own a dehydrator right now, so all my food, nothing is dehydrated. It's all just water-rich food.
That's really fantastic to hear, and I want to follow that up with the second question to that would be that a lot of these women who aren't able to breastfeed, and if they
Mm,
can't get donation of other milk, as you're saying,
yes,
they might turn to giving their baby
formula.
dairy or formula. And what's your thoughts on those kind of things?
Yeah. So I want to say this, and I wish I'd said this in the beginning, but I want to say right now, the beginning of this line of questioning, I think that mamas are doing the best they can with the resources they
Sure.
have and with the knowledge they have, right? And we're all in our own journey. So this is not about, for me, I just want to say, and I know for you too, Ronnie, this is not about bashing moms who make choices like formula or other milk. It's just for women to know that there are choices out there and to not be afraid of this diet we're speaking of as a problem for breast milk. If anything, like I said, it's the opposite. But to speak on formula, so again, women are making the best choices they can. I think whatever, if you can avoid it, wonderful. But if your reality is such, and I've seen this with some women, where they're gone for 12 hours a day because of their work life, they are working in places where they don't have control over their work life, they can't afford a breast pump. I've worked with women like this, and the best bet they have is formula. That's their choice. But
Sure.
is it needed? No. The next thing I would do, if you're not able to produce milk initially, or you think you can't, is something that we did in Africa, in West Africa, when I was working with Doctors Without Borders. I worked with a lot of mamas who themselves were malnourished, and they would come with
Mm.
their baby who was malnourished, and they weren't able to give them enough breast milk because they weren't producing enough. And there's a beautiful, it's so simple, but you can do this all over the world. a beautiful technique of basically you get a tube, and you can ask this to a lactation consultant. Most doctors should know about it. You
Mm,
basically tape the tube on the mama's breast towards the nipple. And so the baby is going to be sucking at the nipple, but they're also sucking on the tube. And connected to this tube is an alternate form of milk, whether it's formula, whether it's maybe something like diluted coconut milk, something like that. So the baby's, or even better, frankly, even better, another mama's human milk, right? Like, and you know, this whole idea of wet nurses is something that's been happening from the beginning of life. Like, we've had mamas not be able to produce milk for whatever reason, and their sisters, their mothers. I had a mom, I'll share this, in West Africa. She was very young, malnourished, but her mom, who had a baby, was, you can get back lactation again. A woman who's lactated before can regain her lactation. So at the end of the day,
mm,
her mom was actually breastfeeding or producing milk for her grandchild. So using other women in the community who are willing to offer their breast milk. And what happens, the baby is sucking on the nipple, but they're also sucking on the tube. And what this does, through oxytocin, the hormone, the baby's getting the milk he or she needs, but they're also beginning to stimulate the mama's breast to start producing the milk
right.
again.
Wow. Yeah.
And
That's
so
that's
that is,
brilliant.
it's incredible, and you see it work, and it's a beautiful reflection on the body's ability to heal and to rejuvenate, because our breasts are designed to be able to do this. And so many women, they come and they say, I don't have any breast milk. They have it. They just need to be able to get healing and stimulation to release it again.
Yeah. Yeah. And going back to the diet, what kind of mistakes do you see people make? You obviously work with people, but I'm assuming you've been around a lot of people who've been trying out living foods kind of a diet.
Yeah.
Have you seen
Mm-hmm.
mistakes that you look out for? And anything, it
Yes.
could be mindset, it could be the way they eat, the restrictions they put on themselves.
Yes.
Can you discuss some of the things that come
Yes.
to your mind?
I'll just say, I think mindset is huge, especially I think there can be a lot of, again, self-judgment, a lot of rules. I can't eat that. I'm not allowed to eat that. Um, and it can come from a very good place. If you come from a history of having been sick, eating maybe cooked food, and you say,
Yeah,
well, I'm going to just eat a living foods raw diet, but again, you don't have all the tools you need mindset wise and practical wise to stay on it. There's a lot of self-beration. Oh, I must hate myself if I can't stay on this diet. And it may not be about self-hate at all. It might just be, again, you don't have the tools that you need. You don't have the emotional resilience or emotional management tools that you need. You don't have enough fruit around. You're not eating enough fruit. So I think
yeah,
mindset and self-judgment is a big thing I see in the living foods community. Huge. What percentage raw
yeah,
are you? You know, which school of thought, who are you listening to? There's a lot of that. And I think the moment you can divest yourself of that, you're already on a better path. Um, and I think another thing I see is, oh, this is a big one I see, and this can be triggering for people to hear. I see a lot of this idea of focusing on what they're eating, but not how you're eating. So for
right,
example, you know, I need to carb up, I need to get my 3,000, 2,000, whatever calories in, and they're
yeah,
just pouring it in. I've worked with clients like this who are just putting it without, and they're doing it while they're on the computer. They're doing it while they are
right,
walking
yeah,
somewhere, just because they need to carb up. And we know, science shows us that the way you eat and the way you digest really affects your digestion and your assimilation. So if you're eating mindlessly, basically, not only do you set yourself up for poor digestion and all the things that come along with it in a physiologic point of view, but also I think just emotionally and mentally, you create a situation with food that's just not very healthy. So I see that
sure.
a lot also. Those are just two things I would say.
Excellent, excellent. Now, over the last few years, there was some people that were kind of publicly went away from a vegan diet, raw vegan diet, and stuff like that. And some of them were saying that they took animal products, all of a sudden they felt better. I don't know if you saw any of those situations, but do you think, as a doctor, as someone that studied this thing, do you think there's any situation in which a person would benefit from going back to eating animal products?
No. And I don't say that as I don't say that for no, I'm being very blunt because I feel I'm very aware of that phenomenon that's happened. And I will also say that I think we vegans can be very compassionate towards animals and the planet, but not compassionate enough to our fellow human beings. And I was actually pretty dismayed about some of the reactions to these people who, some of them I believe were on a very honest path of trying to heal whatever they were going through. And I think some of the backlash they got wasn't the kindest, nor was the most effective. Like, that's not the way to bring somebody back to the plant foods diet, by basically putting putting them on blast. And I understand the reasoning for it, right? Because again, the voiceless, like the animals, can't speak up. So it's a touchy subject. But what I will say is no. And I've worked, I've been a doctor now for over 16 years. And I really believe, and I will share this, that I know at least a couple of them, of the people
Sure.
who left. And I think one big issue is not seeking advice from somebody who understands this lifestyle. And now I
Sure.
really believe there are vegan doctors out there. There are vegan nurse practitioners. There are vegan holistic practitioners of all sorts that you can reach out to. And that's important because not every doctor is going to understand nutrition. In fact, many don't, sadly. More and more do. But so I would say that I don't think there was enough of, from what I saw, enough of seeking help, professional help from people who understand the ins and outs of this diet and lifestyle. And then I also say, there's another thing I wanted to share about that. I was just curious about why more testing of certain things wasn't being done. Fasting.
Yeah.
Okay, fasting is what I want to mention. There was a lot of, there could be a thread of this idea of fasting. And I'll be honest, I think fasting, when done right and when supervised, has its very important place. But I've worked with a lot of people who did a lot of prolonged fasts, and they became more and more depleted. If you have an issue with nutrient deficiency and you keep just doing water fast, maybe it does make you assimilate those nutrients better. But if you are nutrient deficient in something, all you have is what you have to work with. And so it can actually,
Sure.
my point is, it can actually make the problem even worse. And so I heard a lot of these stories of lots of prolonged fasting or different kind of diets, or not eating enough of the right things. Just because it's a raw vegan diet or a vegan diet doesn't mean that it's healthy. I should say that again, actually. Just because the living foods diet or a vegan cooked food diet does not make it healthy for your body. It might be healthy for the animals and for the planet, but it may not be the healthiest for you. And so working with somebody who understands nutrient deficiencies, nutrition physiology, assimilation, and then just what can happen on this diet, I think is key before we then say, oh, it's the diet.
Sure. And I want to explore this topic a little bit further and I want to connect this to a second question, and you're a kind of perfect person to answer this, because today I bumped into quite a young girl who'd been at the UK Fruit Fest a couple of years ago, and she was talking to me about that she was having some issues, some symptoms. She was losing her voice, and it was going and it was coming back. She was very tired, and she'd been to the doctor, and they tested her and found that she was positive for Lyme disease. And they'd given her antibiotics and said that she was and she hadn't taken them yet, and she was saying, what do you think? And she wasn't sure what to say, who to ask and everything, because there's a lot of judgment towards any kind of solution from the medical communities.
Yeah.
Within the raw
Yeah.
vegan lifestyle, often there's
Yes.
resistance to that. And
Yes.
I simply said to her that she should definitely take the antibiotics. That's my personal, I would never go against the doctor's advice when it comes to something like that. Um, Now, I've seen, I've actually probably seen more people come to harm avoiding medicine because of their kind of dogmatic raw vegan idea or whatever, than people being harmed by, this kind of stuff. But there is a lot of negativity towards conventional medical ideas. There's the coronavirus happening at the moment, and a lot of the raw vegans groups and everything, they'll be posting things about this being, fake or not real or whatever. So I'd like to hear some of what's your thoughts on all that kind of stuff, if that makes sense, hopefully.
Yeah, no, it's a great question. I'll keep it very simple, but I love that you brought up dogma. I think dogma, whatever it is, whatever shape it takes, whether it's the left side or the right side politically, in America we have the left, the right, whatever shape it takes, dogma is dogma, and dogma can be very dangerous. So I remember, and I hearken back to my experience when I was in the Amazon. I had the privilege of working with the Shuar Indians, an Amazonian tribe. And what I loved, and I learned from them so beautifully, was this navigation between both traditional medicine and more conventional medicine. So somebody would have maybe a horrible bite from an animal, and it was getting infected. They would go to the shaman and they would get a prayer. That very afternoon, they would go to the herbalist and get a poultice. And that same day, perhaps, they would come to the conventional Ecuadorian, I was in Ecuador at the time, a physician who'd been trained in Western medicine to maybe get a short bout of antibiotics. And there was none of this thing of like, this one is evil and this one is not. And that it's tools. It's tools.
Yeah.
And I love that. And that always stuck with me. And I definitely prescribe medications. I try to avoid it because I think pharmaceutical medication come with side effects. They definitely do. And if we can avoid them, avoid them. But when we can't, thank goodness some of them are around. So to me, it's not about one being evil, but it's about knowing when to use it. And more importantly, understanding that there's underlying causes for things, and rather than just symptom management, treating the underlying cause, which a lot of times harkens back to lifestyle. But I think Lyme disease is a fantastic example. In the case of Lyme disease, gotten from a tick bite, usually, if you can get it within a short window period of time, antibiotics have been shown to be very helpful in preventing a sequela, like a consequence that's not very bad, not bad. Let me say that again, preventing a consequence that could be a problem for you, including brain issues and muscle issues and autoimmune issues. If you miss that window of time, the studies are back and forth depending on many different factors if antibiotics work at all. At that point, you need to start managing what's happened with the person. So that's a great example of taking medication in a timely manner if you can. But if you've missed that opportunity, then how do you work holistically to now address what's going on with the person? So I hope that answers the question. I really feel like, I love that you mentioned this. I think dogma is it's not even that it's just, for me, annoying. It's dangerous. It's dangerous. And it's and it also, I think, can make other people dismiss us very quickly, which is sad. Us being the vegan community, they just laugh it off because they think, if you can't even open your mind to this possibility, how can we take you seriously? And so I do think that there's room for a more balanced and flexible mindset.
Yeah, I don't know when this happened, but at some point the alternative health, raw vegan, raw foods, natural hygiene community at some point decided that the medical movement and or the medical industry and the pharmaceutical industry were like the enemy, and that was, and just decided that was all wrong. And I've really tried, especially at the UK Fruit Fest, to really get the idea across that the medical doctors are definitely not the enemy. That there isn't really an enemy out there that's trying to keep you sick or whatever. It's kind of like it's your own responsibility, and to make intelligent choices, we have to take, as you're saying, all the tools into account and make sure we're. But that's difficult as well. So I'm hearing a little bit that you're saying that you work with people. What was it you do? Is it in a clinic? How are you working now as a doctor?
That has been a journey also. I've worked in many different settings. What I do now that I love doing is I do a few things. So I have consultation sessions, either in person. I love home visits. So if I'm where you are and we're working together, I love to come to people's home because your home says so much about you. So I work at home visits, but I also do a lot of online video sessions with people based on what their issues are. And it can be, as an internist, I see anything from autoimmune disease to high blood pressure to being overweight to thyroid, adrenal, all these different things. And so I do video or audio consultation sessions, or I do home consultation sessions. I also create healing dances. As a dancer, bringing my dance to the picture has been really meaningful. So I create healing dances for people as groups, organizations, and art galleries and museums to help ignite the healing process in whoever is watching them. And that's been a really meaningful part of my work. And then I wrote a book again, and that's not just about my process, but it's also the key tools I now share with people on how they can have a healing journey for themselves.
That's fantastic. Let me ask you a bit more about your dancing. When did
Yeah.
that start? Is that something you've always done? And is that kind of an important part of your, I don't know, staying sane, staying healthy, staying
Mm.
vibrant?
I love that question. Yeah, I've been dancing since I was very, very little, but I didn't start getting formally trained in dance until I came to the States as a teenager, my late teens. So I started late, so to speak, for many people, but I've always been passionate about it. I've loved it. I was part of a professional dance company in New York City, and then I left all that so that I could start doing my own dance work, and I could take it all over the world. So I've done dance performances now in Thailand, in Europe, Haiti. And so the idea with my dance now, which feels really meaningful for me, is to create dance pieces that I craft through poetry, my original poetry, that's again meant to be a healing force for people who watch it. So I've done dance pieces, like when there was an earthquake in Haiti, I did a piece around that. But that's how I've now integrated into my work. It's part of my work. I think of it as medicine, part of my medical bag, the tool in my medical bag. I have my stethoscope and I have my dance, and
Oh, wow.
but it's also medicine for me in a way. As you said, it's not just medicinal for people out there. I have to do it because I can't not do it. And so in that way, it's medicinal for me as well.
Yeah, I mean, I've heard people literally say to me things like dancing saved their life, and
Mm-hmm.
I don't, because I don't have that experience. I don't know exactly what they meant by that, or what is it about dance you think that's important?
Mm.
Uh, and is it like, because yesterday there was a gathering that happened and people started to drum and people started to dance. I thought this is something that is, very deeply human. To get
Yes.
together rhythmically, dancing happens all over the place. What is it?
I think it's two things that come to mind immediately. Now, as a mama, I can say this. I think that dance is something we've been doing since we were conceived. So the
Mm,
moment that baby was in my womb, he was dancing, right? He's surrounded by amniotic fluid. He's literally dancing for 9 months before he comes out. He's listening to the heartbeat, the drum beat of my heart the entire time. To soothe him so many times now, I just dance and his head is against my heart. That's why those baby carriers, I think, are so great, because you're constantly moving and your baby's against your heartbeat. So it's that drum beat and then the dance movement. The second reason is I think it's pre-verbal, right? So it's a
mm,
language that transcends language, culture. Every culture has dance. And so if that's healing, healing and wholeness come from the same etymology, the same word root. And
mm.
I think when we understand our connection with one another, that produces healing. And one of the ways we can connect with one another, no matter where we came from, is through dance, through movement. So I think in those two reasons, for just those two reasons, and there's more I could go into, I think it can be incredibly
Mm.
healing for people.
There's one thing as well that I wanted to touch back on that we mentioned a little bit earlier in the interview, and that was the idea that when people go to this kind of lifestyle, that there is emotional stuff that comes up and emotional healing I would like to understand a little bit more about what that process is. Why is it that people feel like there is this emotional processing that happens when they go towards this lifestyle? And um, from your perspective, maybe a little bit of the medical side, the physiological side, and
Yeah.
also I guess the emotional or spiritual side. What is it that's happening to people when these emotions come up? Are they stored in the body? Is it held back? Is it not able to be dealt with because of the burden of a bad diet, or how does it all work in your eyes?
Yeah, and I'll say part of this is definitely my own experience, but part of this is science. So science, we know that um, a lot of foods will really address and almost overstimulate the dopaminergic system, the part of the brain that modulates dopamine. And basically, it's like getting almost like a high, but after a while, you need more and more of it just to feel okay. That's one
Mhm.
aspect. The other aspect is cortisol. So cortisol is a stress hormone. And a lot of the foods people eat, processed foods we're eating, actually will cause overproduction of cortisol. And so you have this constant kind of feeling of stress that's in the body. When you take all that away, there can be almost this feeling, I think, of emptiness, right? You don't have
Wow.
that buzz you're getting from the dopamine hit. You don't have the
Yeah.
constant like vibratory stress from cortisol. It just feels like emptiness. And emptiness can feel very scary for many people. I know for me, initially, it really did. I felt like I'm not having experience. I feel too empty. And then what also emptiness does, it becomes a vessel to remember,
Mhm.
to feel even more. And if you've never or you haven't felt or been okay with feeling so acutely, it can feel very scary. And so you then go back to the thing that you know, again, consciously or subconsciously, that will take that away from you. So I think that's how it plays. That's how that works. And then I
Yeah.
think to heal that process is becoming okay with sitting with it, sitting with your feelings. So in that book, Delicious Healing, which I'll
Yeah.
just share one thing about that book also, I just released the audio book. And so those people who are not really into reading text but want to hear it, it's my voice reading the whole thing. Um, the heart of that book, chapter 5, is all about emotions. I think it's so key for the healing process, no matter what your healing journey or what you need to heal. And I talk about the idea of how we all have
Mhm.
some emotions that we judge. For me, it was anger. I always felt like I couldn't be a good person and also be anger.
Right.
People have different things. And the idea is, how do you then sit with that? And how do you sit with an emotion and learn from it? The idea that our emotions are actually here not to cause us pain, but actually to be teachers for us. Um, that's one way. I think even if I just offer one thing, just to consider, invite people to think of your emotions not as yours. So they're not your emotions, they're just emotions. And
Mhm.
they come as a possible learning opportunity. And all that needs to happen is you sit with it, even as your skin is crawling, sit with that emotion, get quiet and listen to what it has to teach you. And once it's taught you, it usually will just dissipate. That's what's amazing about it. But a lot of people don't wait. They start feeling very uncomfortable and then they take the bread or they take the
Yep.
meat or they
It,
take whatever drug so they don't feel.
one of the biggest lessons I ever had was when I had some uncomfortable emotions around a situation, and as soon as it came up, the desire was to deny it and to do something to pretend it wasn't there. And one, for some reason, one point I decided I'm just going to sit and focus on it. And as soon as I did that, I realized that it wasn't powerful at all. The only
Yes.
power it had over me was when I thought it was worse than it was, and that made me kind of try and act out and I've realized that more and more when uncomfortable emotions come up. If you can sit and focus on it fully, totally, that it just starts to go away. Very like that's all it. It's almost like it just wants your attention.
Exactly. It's like it's like an inner it's like an inner child just asking for some attention. And so I talk about that, actually, like getting quiet, turning towards it, listening to it, giving it a hug. I know that sounds weird, but embracing it. So you say, so it's not this bad thing you want away from you. Actually embrace it because it's there to teach you. And it's something, I love that thing you just shared. And something that comes up for me is that thing of, that which you resist will persist, right? The more you resist it, the more it actually gets more and more power. But the moment you actually turn towards it and just let go and say, okay, let yourself feel it, that's when it can go. It can actually leave.
Sure. Okay, well, how can people learn more about you, and what are you doing at the moment, and can they follow you online, on your website? Share all that information with us.
Thanks, Ronnie. So I think the best way to reach me is through my website, drtumijohnson.com, DRTUM as in Mary I Johnson, JOHNSON.com. I have a YouTube channel, and that's kind of where you'll find my book and the audiobook, as well as my how to set up a consultation session with me if people are interested. I have a YouTube channel which is called The Poemdances, THEPOEM Dances, DANCES. Same title as my Instagram name. And there on YouTube, you can find videos on holistic health, including things around the fruit diet, the fruity lifestyle. So debunking things like fruit and diabetes being a problem, or fatty liver disease being a problem, as well as my dance is also shared on that YouTube channel. I also share about minimalism, holistic health in general. And yeah, I'm creating more healing dances. I'm seeing my clients and patients. I'm being a mama and a wife and loving our life at the Canary Islands. So I feel really thankful.
That's fantastic. So yeah, every one of you can go and check out what Dr. Tumi is up to on our website, drtumijohnson.com, and all the other links. We'll put links to all that as well. Any last advice you've got for people listening?
What came up to share is just self-kindness. I think there can be, we talked about dogma, we talked about just trying to do what's right. A lot of people in this movement, in the vegan movement, are trying to do what's right. And I think sometimes we can be very hard on ourselves during that journey. And I found that the more self-kindness you can invoke, as you tweak your strategy, as you hone your strategy, the quicker I think you actually get to your vision of what it is you want to create in the world.
Excellent. Well, thank you very much. And for everyone listening and watching, if you've enjoyed this interview, then please feel free to let us know and share if you like to other people. You can rate it if you're listening to it on iTunes, I think. And if you're on YouTube, give us a comment, share it, give us a like, and we hope that you enjoyed it. And we'll see you in another interview. If you want to learn more about a raw vegan lifestyle, you can go to fruitfest.co.uk to learn more about the UK Fruit Fest if you're interested in coming. And yeah, thank you very much for joining us, Dr. Tumi, and we'll see you hopefully again, maybe another time.
Would love to. Bye.